Fundamentally, if your hip pain is limiting your daily life, your quality of life, the activities you'd normally be wanting to do, sleeping, walking, or the sports and the things you enjoy doing, then it's the right time to seek a professional opinion. And usually that's a general practitioner. And once all the conservative options have been exhausted, whether that's changing your activities, taking painkillers, using orthoses, we call them, things like braces or walking sticks and so on, that's the time to then think, well, maybe, with the advice of your GP, do I need to see a surgeon regarding, hip replacement or hip resurfacing surgery? And that's reserved for patients typically with advanced arthritis that have exhausted all those things I just mentioned. But fundamentally, again, it's always a shared decision. So we have to balance your symptoms, your activity goals, and your overall health with the risks and the benefits of surgery. With regards to resurfacing versus replacement, I think, again, it's something worth discussing at great length with your surgeon. We tend to reserve resurfacing for slightly younger patients who are aiming to return to a very high level of activity, because that's probably where resurfacing makes the difference over a hip replacement. But a hip replacement is a tried and tested and very, very successful operation for the vast majority of people with what we call end-stage hip arthritis. Well, a hip replacement, like any major surgery, has some risks, including infection, blood clots, dislocation, fractures, and leg length discrepancy. These are all uncommon, and we take strong measures to reduce them, although there'll always be a non-zero risk. So, for example, for infection, we give antibiotics. To reduce the risk of blood clots, we provide stockings and blood thinners for a short period after surgery. And to reduce the risk of dislocation and leg length discrepancy, we'd always plan your surgery with CT scans, with x-rays, make sure we get the appropriate surgical templates, and then in surgery we use either navigation or robotics, so that at the point of you leaving hospital, we're confident that that hip is both stable and feels like a normal hip. Ultimately, the benefits do outweigh the risks, and the risks are uncommon, but it's still important to decide together with you when the right time is for surgery, and whether you feel that the risks are worthwhile, and also the recovery pathway is at the right time of life for you. Well, most people are walking within a day or so of surgery. And for the first 6 weeks, I tend to advise using crutches. That allows the bone around the implant to bond with the implant itself. And by 6 weeks, most patients are back to their normal daily activities. By about 3 months, most people will experience a significant difference compared to their preoperative state. But really, it's worth stressing that full recovery and then strength as well continues to build over 6 to 12 months after surgery. You can safely do most things, low impact activities. So that's things like walking, cycling, swimming, golf, and so on, and doubles tennis as well. They're all very much within normal after hip replacement. So high impact sports, such as running or jumping, I think that there's no good data to suggest that they're not safe. I think from a practical point of view, there is a concern that doing those and lots of that activity might reduce the lifespan of your hip replacement. But when one uses bearing surfaces like modern ceramic, which doesn't wear out at all, one would think that the risk of wear is very, very low indeed. But generally, we say that the first 6 weeks to avoid a few things that might induce instability around hip or slow down your healing. But after that, certainly in my practice, there's no real limitation in terms of what I would suggest you can and can't do, because ultimately patients will do whatever they'd like to do to get back to what they love doing. I think the current data suggests that modern hip replacements last at least 15 to 20 years. But of course, that data is based on older data with older technologies and ways of doing things. So looking forward, I think the answer in 10 years might be very, very different. Ultimately, I aim to give patients a hip replacement that will last their lifetime. But mathematically speaking, younger patients have a higher chance of redo and revision in their lifetime because they're younger. surgery is designed to give you durable pain relief and mobility. So I don't think one should think of a hip replacement as a ticking clock waiting to wear out and requiring a redo. And we just don't know right now exactly how long your hip replacement will last beyond that 15 to 20 year lifespan.